Bartholomew Town, bringing Rhode Islanders closer to their world since 2018. Brought to you in part by the University of Rhode Island Online, Newport Film, Half Street Group, Navigant Credit Union, and the Audubon Society of Rhode Island.
Bartholomew Town.
All right, welcome into Bartholomew Town. I'm Bill Bartholomew. Always a great pleasure to spend some time with you. And we're talking about a topic that is, it is obvious that it's something we need to focus on. Data supported, anecdotally supported, and that's broadly speaking mental health, but specifically speaking men's mental health. And Dr. Jerry Larkin joins us from the Rhode Department of Health to get into some of the details of an initiative that they've launched and broadly discuss this extremely important topic. So, Doctor, thanks so much for your time.
Thank you for having me.
Give us the rundown right now on, from a programmatic basis, the initiative that the Rhode Island Department of Health is engaged in when it comes to men's mental health.
So we are having a campaign this month. June is Men's Mental Health Awareness Month, and we are rolling out our Are You Good Man campaign. This is a statewide campaign, campaign to raise awareness and prevent suicide among working age men. That they're a population that are experiencing suicide at nearly twice the rate of the general public in Rhode Island. The campaign includes a powerful video that tells a story about the power of connection. And we're also doing some social media posting across many different channels and running social media, digital, and streaming platform, local movie theaters, and gas stations. And as part of the campaign, yougoodman.org, so that's a website, yougoodman, YOUGOODMAN.org, was created as a resource hub offering mental health tips, warning signs, conversation guides, and local support services. We are also working with Reach Consulting, which is a local firm which helped develop the campaign following months of research and interviews with Rhode Island men. And their input really helped shape the campaign's tone, the messaging, and the creative direction. And one clear message emerged. Many men struggle in silence, and even a simple check-in can make a difference.
Right now is a moment where chaos is the norm. And it's easy for anybody to sit back and say, boy, I'm uncertain about the future. And when you couple that with everything that has already been contributing to mental health, the social atomization piece that is a derivative, or you can make the argument it's a cycle of social media, of less investment in public spaces, of a general disconnect, a political environment where people now are essentially told to hate each other if they have a different view on a particular issue. Then take the anxiety of the future. I mean, are we going to blow the planet up? What about climate change? These are all real things. Some people laugh at it and say, and they contribute to the problem. Those who would laugh at somebody for expressing concern. So it's a legitimate moment to be anxious. How does all of this right now, this soup that we're swimming in, how does that impact the type of messaging that the Department of Health is putting forward? I'll put it this way. Director Kasim Yarn for now Department of Veterans Affairs, he has a line that I think is really powerful, which is, it's okay to not be okay. And in a world like this, it's okay to not be okay. Is that impacting your messaging as you try to reach more men with this?
I think it does, because I think he's absolutely correct. And that's the insidious part of the internet is that there are messages that are shaped to make people behave or think in a particular way. And so I think not only does it create distance between us kind of physically or kind of in a more genuine way, but it also creates ideas of what is what aspirations are, what our aspirations should be. What does it mean to be a man? What does it mean to be strong? And that really can work against all of us. We certainly see this in adolescence, and we see how children sometimes are affected in this way, but actually adults can be as well. I'm not sure if that actually got to your question, but
well, I think the big thing right now is that more than ever before, with the environment that we're living in, and with the rise in suicide rates that you just noted, and with a a cultural shift towards individualism and away from collective good. Sometimes we see actions taken that are clearly for individual gain and not for collective good. It's more important than ever before to take care of yourself, to take care of your mental and obviously physical, but also in spiritual health. And to do that, you have to acknowledge that there's a problem and a challenge to begin with. And why do you think it is that men are seeing, either anecdotally or data based, why do you think it is that we're seeing a specific challenge with men right now?
Well, stigma certainly plays a factor. Again, men are expected to be emotionally stable and have a strong and independent and self-reliant demeanor. So you get to that somewhat in your question about, men are supposed to, be these rugged individuals, which in and of itself is a bit of a fairy tale that this country was built by people lifting themselves up by their
Bartholomew Town.
Half Street Group brings a new generation's perspective to leadership communications, strategic public relations, and digital marketing. Half Street helps organizations and leaders take control of their own stories and manage their reputations. They get results for their clients by focusing on audience, message, and culture, and by leveraging their decade-long relationship with media and opinion leaders in the Ocean State and throughout New England. Join me and Half Street Group founder and president Mike Rea for a conversation every month about news of the day, the hottest media analysis, and a look behind the scenes at how impactful leaders drive conversations. Learn more at halfstreetgroup.com. As Rhode Island's first ever member-owned credit union, Navigant Credit Union has been a staple in the local business community for more than 108 years. Yeah. Today, Navigant is a $3.4 billion institution serving more than 136,000 members across 25 physical branch locations. But since its founding in 1915, the mission has never changed. Navigant Credit Union's team of financial professionals have remained committed to improving the financial well-being of the families, businesses, and communities they serve across Rhode Island. Learn more at navigantcu.org.
bootstraps or clearing the forest single-handedly. If anything, the opposite was actually was more true, in that in our sort of frontier history, social connection was actually extraordinarily important, because there was no other, you'd had to rely on your neighbors, which sort of is the counterpoint, I think, of the American ethos to that rugged individualism, is that we are a united country, a united people who are committed to each other. So, but at any rate, when we are really just focused on that rugged individualism, men sometimes conceal their own health needs and refuse to seek care. And we also know that many men are less integrated into social networks, partially because of this archetype of the independent man. And so having meaningful relationships is so important for good mental and emotional well-being that maybe they don't have that social network, maybe outside of, except within their nuclear family, and maybe not even in their nuclear family, and maybe not even in their own homes do they feel integrated and socially connected or emotionally connected.
Yeah. That makes complete sense. A lot of it, like you said, it's based on a fairy tale and a notion of strength and what strength actually means. Make the counter argument, which I think is quite valid, which is that strength is actually reflected in someone who addresses their own weaknesses and their own needs. So some of the tools that are available for people, obviously there's a variety of different, you can say, therapy, but that is a certain, that's one flavor. And that is also, there are many ways to go about that. There are different levels of therapy. There are different types of therapy. There's obviously, even just on an individual basis, you can spend time trying to reflect on your own status and what needs to happen. Just sort of self-care and practices like that. But what do you recommend for people right now if they're hearing this and they're saying, you know what, it's true, I am in a tough spot. but I'm also worried about that stigma that comes with taking care of myself. What do you say to men or people who are hearing this and know somebody that qualifies as what I just described?
Well, I think, again, to Director Yarn's point, acknowledging that it's okay to not feel okay. And it's even okay to not feel okay for, periods of time. But in terms of what I would do to try and help someone in that, it can be as basic as just reaching out, which is sort of where the inception of the title for the campaign comes from. You good man, ask someone, how are you doing? Even that simple question, even if you can't do much more than that, that giving someone the knowledge that you do care about them can be a source of strength and resilience. And then listening is always, something we tend to think of as being passive, but it actually can be quite active and sort of, just understanding what someone's story is and reflecting back in an empathic way what you're hearing. And then there's other more formal things. We have the certified community behavioral health centers. So these are outpatients clinics that are certified by the state of Rhode Island to offer expanded behavioral health services. They launched in October 2024, and they serve everyone who walks through the door, regardless of age, diagnosis, or insurance status. And each clinic has a trained veteran service officer and a whole other team of trained health professionals. They also provide mental support to loved ones and support for addressing substance use conditions and a 24/7 crisis support. And then they are in several different communities. There's a total of 6 different communities, and all the counties are served.
What would you say right now when we look at our state, when we look at Rhode Island? We just passed, the Senate and House just approved a pretty significant budget. Is there enough in there for mental health? Are we prioritizing this as a society? I mean, look, healthcare is in crisis. We know that writ large. But in terms of the focus on mental health, does it get the legislative and governmental attention that it deserves, notwithstanding the fact that you've got this campaign you're rolling out? Is this issue prioritized the way it ought to be?
I think it is prioritized the way it ought to be at a state level. Again, it's difficult to move the needle on many big.
Bartholomew Town.
Newport Film Outdoors is back starting Thursday, June 26th at the Great Friends Meeting House. This beloved 10-week series opens with the award-winning documentary, The Last Dive. Come with your blanket and lawn chair for free popcorn, live music, a pre-film conversation with the director, and a sunset screening. Head to newportfilm.com for all details. Are you ready to take the next step in your career? At URI Online, they offer business and leadership-focused programs designed to fit your life. Whether your goal is to advance your career in fields like public administration, supply chain management, or training and development, their online programs provide the flexibility you need with a high-quality education you deserve. Learn more from experienced faculty and collaborate with a network of professionals, all from the comfort of your home or wherever life takes you. Visit uri.edu/online to explore programs and start building your future today. URI Online. Learn anywhere with us. Birds are disappearing from our landscape at a rapid pace. Over 1/3 of those breeding on Audubon Society of Rhode Island's wildlife refuges are in decline. Climate change has taken a toll on their migration, nesting, and food sources. While science is highlighting the problem, Audubon is working on real solutions with a plan to rapidly reduce their carbon emissions. The organization will be free of fossil fuels by 2030, with renewable energy powering Audubon's buildings, equipment, and vehicles. To shape our future, all of us must act. Learn more about Repowering Audubon, their avian research, and how you can join their fight for climate resiliency. Visit asri.org/repower.
Issues without also having the kind of whole country pulling in that direction. And as you know, there's an awful lot of churn right now in how federal funding is going to move going forward. And the legislature always has a very difficult job, as does the governor, of creating a budget that is not going to set the state back. But do I believe that the state is doing everything it can? I think it absolutely is doing everything it can. And I think that the work of, again, the certified community behavioral health centers, as well as work of things like the government's task force on opiates, the healthcare planning cabinet, the work of Richard LeClaire at BHDDH, the secretary of the work of the Secretary of Health and Human Services, Richard Charest, the Assistant Secretary Anna Navaish, Director Yarns at Yarn at Veterans Services or Veterans Affairs. You know, all of that is part of a spectrum of efforts being made statewide to address mental health.
Dr. Larkin, thanks so much for your time today. One last question, in terms of continuing this beyond the campaign. It's always, whenever a campaign's rolled out, obviously it's a messaging moment. It's a moment to almost a call to action. June is a significant month for this conversation we're having today. Withstanding or sustaining this as potentially the world gets more chaotic. And we don't know what's going to happen. I mean, things might all of a sudden turn into utopia by August. I mean, that's optimistic thinking, but it's going to be, I think a lot of people are expecting this to be a challenging time. What can people do that are hearing this right now and say, I need help? What do they do? How do they get in touch with the providers and with the expertise that the state and not only from a state governmental standpoint, but that are available in the state? How can they get connected?
So again, I would start with our certified community behavioral health centers. I'll list off where they are located. They're at Community Care Alliance in Woonsocket, Family Service of Rhode Island in Providence, Gateway Healthcare in Pawtucket Johnson in South County, Newport Mental Health for Newport County, Providence Center for Providence, and the Thrive Behavioral Health at Warwick. That's a good place to start. Also, you can work with your primary care provider to find an appropriate resource for you. It's always important to mention the 988 Suicide and Crisis Lifeline. So all you need to do is pick up your phone and dial 988, or you can go to 988lifeline.org, and there are trained crisis counselors available 24 hours a day, 7 days a week. You can go to our website, yougoodman.org, to learn how to check on the men in your life and read about what Rhode Island men say about mental health and supporting each other, and watch the You Good Man short video there. And then there's also resources available at preventsuicideri.org and the preventoverdoseri.org. So all of those are, So all of those are available. So
thank you so much for your time, Dr. Larkin. Appreciate it.
Okay, thank you.
Hey, thanks for stopping by Bartholomew Town. For more content, follow me on Instagram at Bill Bartholomew.